Okay, let's unpack this. Today we are doing a deep dive into what is, I think, the single most confusing skin complaint out there.
Hmm.
Dehydrated skin. Our mission is to just cut through all the confusion, the tightness, the flaking, and give you a really clear, actionable guide
Yes.
to figure out if your skin is actually thirsty or if it's just, oil starved.
And that distinction, that is probably the most important piece of knowledge you can have about
Yeah.
your skin's health.
Right.
The sources we're working with today, they really detail the crucial biological difference between an oil deficiency and a water deficiency.
It seems so fundamental.
It is. If you leave this deep dive knowing which one you have, you can, fundamentally change your entire routine for the better.
So let's start with that core paradox, the one that gets everyone. How can your face feel oily?
Right. Slick even.
Slick, and yet, at the same time, be just desperately thirsty underneath? It feels like it shouldn't be possible.
It's completely counterintuitive. But
Yeah.
it makes sense once you realize dehydrated skin is a transient condition.
Meaning it can come and go.
Exactly.
Yeah.
It's just lacking water right now. And that means it can affect any skin type,
Yeah.
even someone who is naturally very oily. Dry skin, on the other hand, that's a skin type.
It's genetic.
It's in your DNA. It's defined by not producing enough oil.
So understanding that is, like, the key to the whole thing. Dehydration is a state, dryness is a type.
That's the technical foundation. So
Yes.
let's really define the difference from a structural standpoint.
Yeah.
What's actually happening in the skin?
Let's do it. Lay out the critical difference for us. What are they missing and what do they need?
Okay, so if you think big picture, it's all about what's missing. Dry skin. It's lacking lipids.
Fats, natural oil.
Exactly. Fats, oils. So to treat it, you need rich, oil-based moisturizers, things we call emollients.
Like shea butter.
Shea butter, squalane, ceramides. These are ingredients that literally go in and plug the gaps in that leaky lipid barrier. It's like patching a roof with tar.
So dry skin has like a hole in its armor because it just can't make enough of its own protective fat.
Precisely. Now, dehydrated skin is lacking water. It's a hydration issue.
Totally different problem.
Totally different. And it needs a combined approach. You need humectants, which are applied topically to attract water, then occlusives to seal it. And this is critical internal hydration.
So if you just slap oil on dehydrated skin,
You're just sealing the top of an empty jar. You haven't actually put any water in it.
that's a powerful image. Sealing an empty jar versus filling it first.
Okay, now for the big confusion, the paradox.
Yeah.
What's the specific thing that happens that makes diagnosing this so tricky for most people?
This is fascinating, actually. When skin gets severely dehydrated, it can do something really strange. It can start producing excess oil
As a defense mechanism.
as a frantic compensatory technique. The skin knows it's losing water way too fast, and its only tool to fight back is to pump out sebum to try and create a makeshift barrier.
And that's when you get that weird combination.
That's it. You end up with a shiny T-zone, maybe breakouts, but at the same time, this overall feeling of tightness, maybe even flaking on your cheeks. Okay, that is such a critical learning point. So if you're listening and you've got that oily but tight feeling, how do you know for sure? What's a simple test you can do, like, right now?
The easiest one is the pinch test. It's really simple.
Okay.
Use your thumb and forefinger and just gently pinch the skin on your forehead or on your cheek. Hold it for a second. If the skin creases a little bit or looks kind of crepey or just doesn't immediately bounce back, that's a sign of dehydration.
A lack of suppleness.
Exactly. Hydrated skin will just snap right back, almost like a new rubber band.
And what about just looking in the mirror? Are there other visual cues we should be looking for?
Yeah, look for a sort of generalized dullness. Your skin just looks a bit flat. Also pay attention to that constant feeling of tightness, especially right after you wash your face.
Oh, that's a big one.
It's a huge one. Or when you've been in an air-conditioned office all day.
Yeah.
But the most revealing sign is what we call transient fine lines.
Meaning they aren't permanent wrinkles?
Not at all. You'll see them around your eyes or on your forehead, but the moment you apply a hydrating serum, they just plump up and vanish.
And that's how you know it was just water loss, not actual aging.
That's your confirmation right there.
That's a fantastic differentiator. Now, for people who are more technical, maybe they've seen a dermatologist. You mentioned there are specific tools they use to get past the subjective feelings.
Right. Dermatologists can eliminate the guesswork. They use a tool called the corneometer.
A corneometer.
It measures electrical capacitance, which basically gives a precise number for the water content in the stratum corneum, the very top layer of your skin.
So it's a direct measurement of hydration.
It is. And they also use a 2-ammeter. That measures transepidermal water loss.
TEWL. We hear that acronym a lot.
Yes, TEWL. If a specialist measures your TEWL, a high reading is very significant.
What's it telling you? Is it just that you're losing water, or is it saying something deeper about my skin barrier?
It's telling you everything about your barrier's integrity. High TEWL means your barrier is damaged. It's compromised. It can't hold on to moisture.
So the mortar between the bricks of my skin cells is just crumbling.
That's a perfect way to put it. And these measurements give a professional a baseline, They can track if a treatment is actually working to reduce the water leakage, not just temporarily masking the feeling.
Okay, that gives us a really solid foundation on diagnosis. So now we have to pivot. We know the solution isn't just oil. Let's talk about the real enemy here. Where are we losing all this water every day?
Well, we need to understand that dehydration isn't usually. It's not a primary defect. It's almost always a result of things we do or environments we live in.
And here's where it gets really interesting, because some of these are like constant daily things we don't even notice. Let's start with the environment.
The external aggressors are they're relentless. You have harsh weather, cold, dry air, strong winds that literally strips moisture away.
Sun exposure, too.
Oh, prolonged unprotected sun exposure is terrible. It weakens the protective layer and just accelerates water evaporation. But I think the sneakiest ones are the indoor environments.
The office, the airplane.
Exactly. Forced air heating in the winter and aggressive AC in the summer are constantly pulling humidity out of the air and, by extension, right out of your skin.
I know so many people who swear by super hot showers. Especially in the winter, it's like this cozy ritual.
But it's a moisture-stripping ritual. It's a major, major culprit.
How so?
That really hot water, it breaks down and depletes your skin's natural oils, the very oils that are supposed to hold water in. And then when you get out of the shower, that water evaporates so quickly off your skin's surface.
And it takes even more moisture with it.
It creates a moisture vacuum and it leaves your skin tight, dry, and really vulnerable.
Okay, so beyond the environment, we're also doing damage with our own products. Which skincare items are the worst offenders for disrupting that moisture barrier?
You really have to be careful with overuse. Overuse of cosmetics with high amounts of drying alcohols, really powerful acids, or harsh physical scrubs.
So like over-exfoliating.
Definitely. Or using cleansers that create a huge, satisfying foam with harsh sulfates. All of those things compromise the barrier. They just strip the skin of its natural hydration and protective lipids and leave it totally unable to hold on to water.
So we have these external attacks. Then, as if that's not enough, our own lifestyle choices are creating this constant internal leak. If we aren't drinking enough water, how does the body handle that?
When you don't drink enough, your body goes into a critical management mode. It has to prioritize.
Survival.
Right. It sends the water it does have to your essential organs, to your blood circulation. When your skin is way down the priority list, it's basically the last to get a drink.
So it's always undernourished.
Always, which leads to that decrease in volume and elasticity.
And on top of not drinking enough, we sometimes intentionally add things that make it worse. Diuretics.
Exactly. All that coffee, all that alcohol. They accelerate the body's water loss by increasing urine production. It's a systemic dehydration that shows up directly on your face.
We should also touch on the stress connection here, because it's not just about forgetting to drink water when you're busy. There's a physiological component with cortisol.
Right. It's a direct inflammatory pathway. Chronic stress means your body's releasing cortisol all the time.
And what does cortisol do to the skin?
High cortisol levels actually hinder the production of the very things your barrier needs, lipids and hyaluronic acid.
Wow.
So a barrier that's damaged by cortisol means higher TEWL no matter how much cream you're putting on. And then you add in poor sleep, which stops the skin's repair cycle, and you've got a perfect storm.
And I guess we should briefly mention things like being sick, fever, vomiting, that kind of rapid fluid loss.
Absolutely. Any dramatic loss of bodily fluids will always show up first in your skin hydration levels. Even just excessive sweating from a hard workout, if you don't rehydrate properly, can leave the skin looking totally parched.
Okay, so we've laid out the problem, the causes.
Yeah.
It's multifaceted. For the good part, the solution. A targeted skincare routine to fix this.
The treatment goals are really clear. First, you have to restore the skin's water balance using attractants. And second, you have to stop any more water from leaving using sealants.
So a two-pronged attack.
Exactly. And we approach it with a logical, multi-step layering routine that respects the barrier.
Walk us through it. What's the optimal sequence from start to finish?
It all starts with a gentle cleanser. This is non-negotiable.
So no foam, no squeaky clean?
No. Use a cream, an oil-based, or just a non-foaming sulfate-free cleanser, something that cleans without stripping. Next, a hydrating toner.
What are we looking for in the toner?
Humectants, hyaluronic acid, glycerin, something to immediately give that first layer of water back to the skin and prime it so it can absorb the next steps better.
And then comes the main event for moisture.
The hydrating serum. This is your water delivery step. It has to be rich in humectants. And here's a key tip. Apply it while your skin is still slightly damp from the toner.
Why damp?
Damp skin is like a sponge. It just soaks up those ingredients way more effectively.
And then we have to lock it all in. The moisturizer.
The moisturizer is your protective envelope. It needs to be a rich cream that does two things. It should have more humectants to keep attracting water, and it must have occlusives to lock it all in.
And every morning.
Every single morning, sunscreen. Broad spectrum SPF 30 or higher. We always think of SPF for preventing burns, but here, it's about protecting that barrier from the constant moisture-sapping damage from UV rays.
Then what about at night? Is there an extra step?
Yes. In the evening, I'd recommend adding a night mask or a heavier facial oil as the very last step. It's a final occlusive layer that really supports the skin's regeneration cycle and stops that overnight water loss.
Let's break down those ingredient types because this is where people need to know the terms. If the skin is a desert, you said humectants are like the rain. Which ones are the heavy hitters?
So humectants are these amazing molecules that act like little sponges. They pull water from the deeper layers of your skin or even from the air around you. The undisputed star is hyaluronic acid.
The one that holds, what, 1,000 times its weight in water?
That's the one. It's incredible. But you also have glycerin, aloe vera, panthenol, which is vitamin B5, and urea, all great humectants.
Okay, great. Now for the occlusives. The bouncers at the club door that keep the hydration from leaving. You said they're like a raincoat.
That is a perfect analogy.
Yeah.
They create that physical barrier to stop evaporation. The top-tier occlusives include ceramides.
Which are lipids, right? Part of the natural barrier.
They are, so they're literally replacing what's missing. Squalane's another fantastic one because it's so lightweight and non-comedogenic. It mimics our own natural sebum. Then you have shea butter, and of course for maximum sealing power, petroleum jelly.
So a question we get a lot is about facial oils. If dehydrated skin lacks water, not oil, do oils even help?
They are crucial, but for a very specific reason.
Yeah.
Facial oils themselves do not hydrate. They don't contain water. But they are vital for dehydrated skin because they are the ultimate occlusive barrier.
So they're the final seal.
They create that film on the skin's surface that very effectively seals in all the water you just applied with your humectant toners and serums. They are the key to stopping TEWL in its tracks.
The oil is the lid on the hydration jar, but you have to fill the jar with water-based products first.
Precisely. If you only use oil, the tightness will remain. You've just put a lid on an empty, dry jar.
Okay, so what does this all mean for the big picture? Let's bring this back to holistic health and managing this long-term, starting with what we're drinking.
The management has to be internal as well as external. We have to reinforce drinking enough water, at least 8 glasses a day. It sounds basic, but it's fundamental for maintaining cellular volume. If your whole system is running dry, no topical product can fully fix that.
And diet. It's more than just eat your vegetables, right? How does food specifically help build that barrier?
You need compounds that literally become part of the skin's structure.
From the inside out.
Exactly. Omega-3 fatty acids are so important. You find them in fatty fish, walnuts, flax seeds. They become part of your cell membranes, making them more fluid and reinforcing that lipid barrier from within.
So it's harder for water to get out. And what about foods that work against us?
You really want to minimize sugary diets, processed foods, and anything super salty.
Why sugar?
A high-sugar diet causes insulin spikes, which leads to systemic inflammation. And that inflammation directly messes with your skin's barrier function. It just makes everything worse. And salty snacks literally pull water out of your cells through osmosis.
We have to stress the complications here. If you just let this go on, it's more than just feeling tight. It can lead to other problems.
Oh, absolutely. Untreated dehydration means your protective layer is chronically weak. That leads to enhanced sensitivity, redness, irritation, because pollutants and irritants can just get right
Or it
in.
can make you look older.
It causes what we call false aging. Those fine lines and wrinkles appear way more prominent because the skin has lost its plumpness.
And that oily breakout paradox you mentioned earlier, it just keeps going.
It does. That compensatory oil overproduction clogs pores, leads to acne. especially because the oil is being produced on skin that's already inflamed and struggling. And for anyone with existing conditions like eczema or rosacea, dehydration is a major trigger for flare-ups.
Okay, so let's say we've done everything right. We've changed our routine, we're using humectants, we've stopped the hot showers, but the tightness and redness are still there. When is it time to stop playing scientist in your own bathroom and call an expert?
I'd say if those symptoms, the tightness, the redness, the flaking, if they persist after, say, a month of really dedicated lifestyle and skincare changes, it's time to call a dermatologist.
Because it could be something else.
It could be. Persistent dehydration might point to a more complex underlying issue, a chronic barrier disorder, or something that needs a prescription to manage.
And what can a professional do in their office that we can't do at home?
They can use treatments designed for immediate, intensive barrier repair. Things like professional hydrating facials that use really high concentrations of hyaluronic acid. They might suggest microneedling to get serums deeper into the skin, or even very mild chemical peels.
A peel sounds scary for compromised skin.
It sounds counterintuitive, but a very gentle lactic acid peel can carefully remove the top layer of dead cells that are actually blocking moisture from getting in.
This has been so clarifying. We've really separated the oil problem from the water problem. Let's do a quick final summary of the absolute core takeaways.
To summarize, dehydrated skin is the lack of water, and it's temporary. Dry skin is the lack of oil, and it's permanent. That distinction is everything, because just using oil on dehydrated skin won't work. You have to supply the water first.
And the solution is that strategic layering. Humectants like hyaluronic acid to attract the water, and then occlusives like ceramides and squalane to lock it all in. And you have to remember your environment. Hot air, cold air, hot showers is working against you.
And finally, that this condition is often a sign of a systemic imbalance. From your diet, your stress levels, your sleep. The path to a truly healthy skin barrier really does begin on the inside.
Absolutely. We've established that dehydration is often less about your genetics and more about your life. Chronic stress, too much coffee, not enough sleep. It's so easy to focus on just the serums and creams, but we want to leave you with one final thought. If your skin's constant tightness is a direct result of your busy schedule, from prioritizing that coffee over a glass of water to sacrificing sleep for work, what is the single most urgent non-skincare habit you need to change, starting today, to truly begin healing your skin barrier? Think about starting that healing process from the inside out.